before the patient arrives. 2. When the patient arrives. 3. Prepare for the infusion. 4. Prepare the infusion site and administer the infusion. 5. After the infusion. Let's begin. Section 1. Before the patient arrives. The first thing you'll want to do is prepare the vials of rystiggo. Remove the vials from storage. If they have been stored in the fridge, allow time for them to naturally reach room temperature. Do not use heating devices. Do not shake. Check that you have everything you need on hand to administer the infusion. This includes a compatible infusion pump and the appropriate ancillaries, including a syringe, transfer needles, a sharps container, alcohol wipes, infusion set with a 26-gauge needle or larger, and a line of 61 centimeters or shorter, adhesive tape, and dressing. Check each vial. Confirm that they have not reached their expiration date. Make sure the solution appears colorless to pale brownish yellow and clear to slightly opalescent. And check that the protective cap is intact and sealed. Section 2. When the patient arrives. Check the patient's details when they arrive. Make sure the patient is comfortable. They should be in a semi-reclined position to allow easy access to the infusion site. Section 3. Prepare for the infusion. Disinfect your work surface and leave it to air dry while you wash hands thoroughly using soap and water or hand sanitizer. Put on suitable clinical gloves as per your center's protocol, and lay out all items for the infusion. Remove the protective flip-off plastic cap from the vials. Do not remove the vial stopper. Wipe the vial stopper with an alcohol wipe and allow to dry. Transfer the liquid from the vials to the syringe using a transfer needle. A small amount will remain in the vials and should be discarded. If you are transferring liquid from more than one vial, repeat these steps and use a clean transfer needle for each vial. Remove the needle from the syringe and attach the infusion set. It is recommended to use a 26-gauge needle or larger and an infusion line that is 61 centimeters or shorter. Prime the infusion set with the priming volume in the vial to eliminate any remaining air. Only do this immediately before the infusion. Set up the infusion pump according to the manufacturer's instructions and your center's protocols. Ensure that the occlusion pressure alarm is set to the maximum setting. Preset the pump to deliver the prescribed volume. For pumps that cannot be preset, after priming the infusion line, adjust the volume to be administered by expelling any excess volume. Section 4. Prepare the infusion site and administer the infusion. Make sure the patient is comfortable. They should be in a semi-reclined position to allow easy access to the infusion site. Choose an area on the patient's abdomen, below and to either side of the belly button. Never infuse into areas where the skin is tender, bruised, red, or hard. Avoid infusing into tattoos, scars, or stretch marks. Rotate infusion sites from one infusion to the next. Clean the infusion site with an alcohol wipe and allow to dry completely. Using 2 fingers, pinch together the skin around the infusion site. With a quick dart-like motion, insert the infusion set needle into the subcutaneous tissue. Once you've inserted the needle, secure it to the skin using tape or transparent dressing. Start the infusion pump according to the manufacturer's instructions. Rystiggo should be infused at a constant flow rate up to 20 milliliters per hour. Take note of the infusion details, the dose and volume administered, including start time and flow rate, according to your local protocol. Section 5. After the infusion. Remove the transparent dressing or tape and the needle. You might see a drop or two of leakage after the needle is removed. When the infusion is complete, do not flush the infusion line. Continue to monitor the patient for 15 minutes for signs and symptoms of hypersensitivity reactions. Discard all items, including empty or partial rystiggo vials, in a sharps bin. Do not reuse contents of the partial vials. Check the infusion site for any reactions such as rash, redness, or swelling, and then apply a dressing. Monitor patients during treatment and for 15 minutes after the administration is complete for clinical signs and symptoms of hypersensitivity reactions. Before the patient leaves, check again for any adverse reactions and that they need no further assistance. Confirm with the patient that they have the proper contact details should any adverse reactions occur, and ask if they have any questions. It's also a good time to confirm their next infusion appointment date. The administration of the rystiggo infusion is complete. You should also refer to the prescribing information to review any of the steps. Indication: rystiggo, rozanolixizumab noli, is indicated for the treatment of generalized myasthenia gravis, GMG, in adult patients who are anti-acetylcholine receptor, AChR, or anti-muscle specific tyrosine kinase, MuSK, antibody positive. Important safety information. Warnings and precautions. Infections. Rystiggo may increase the risk of infection. Delay rystiggo administration in patients with an active infection until the infection is resolved. During treatment with rystiggo, monitor for clinical signs and symptoms of infection. If serious infection occurs, administer appropriate treatment and consider withholding rystiggo until the infection has resolved. Immunization. Immunization with vaccines during rystiggo treatment has not been studied. The safety of immunization with live or live attenuated vaccines and the response to immunization with any vaccine are unknown. Because rystiggo causes a reduction in IgG levels, vaccination with live attenuated or live vaccines is not recommended during treatment with rystiggo. Evaluate the need to administer age-appropriate vaccines according to immunization guidelines before initiation of a new treatment cycle with rystiggo. Aseptic meningitis. Serious adverse reactions of aseptic meningitis, also called drug-induced aseptic meningitis, have been reported in patients treated with rystiggo. If symptoms consistent with aseptic meningitis develop, diagnostic workup and treatment should be initiated according to the standard of care. Hypersensitivity reactions. Hypersensitivity reactions, including angioedema and rash, were observed in patients treated with rystiggo. Management of hypersensitivity reactions depends on the type and severity of the reaction. Monitor patients during treatment with rystiggo and for 15 minutes after for clinical signs and symptoms of hypersensitivity reactions. If a reaction occurs, institute appropriate measures if needed. Adverse reactions. In a placebo-controlled study, the most common adverse reactions, reported in at least 10% of rystiggo-treated patients, were headache, infections, diarrhea, pyrexia, hypersensitivity reactions, and nausea. Serious infections were reported in 4% of patients treated with rystiggo. 3 fatal cases of pneumonia were identified, caused by COVID-19 infection in 2 patients and an unknown pathogen in 1 patient. 6 cases of infections led to discontinuation of rystiggo. Please see the full prescribing information at www.rystiggohcp.com.